So, what is a health coach?
So, a health coach supports with a person making positive lifestyle changes around any type of long term condition. I think Deb has mentioned a couple of examples around like diabetes, pre-diabetes specifically because it's getting in there before, and a lot of the time when people have had a diagnosis of diabetes or have diabetes is that they've already been through a process, so they might be in part of specialist care. So that's mainly supported by the GP and other external services.
Sure.
But the health coach can help alongside the GP as well as the health improvement practitioner to be able to put in practical goals and then pretty much coach them through those goals and working towards improving their health and well-being. Yeah. So pretty.
And is it something that the doctor refers you to, or the HIP refers to you, or how does that work?
Anyone can refer through to the health coach, specifically obviously because it is based in general practice, a GP or a nurse or the health improvement practitioner. If there's any thing that comes up in the community, maybe there's like a community service that health coach or has connected with that can refer back into the general practice. So it's I guess a collaboration between primary care and then other services in the community.
Okay. And what sort of cost is involved with health coach?
Same as the health improvement practitioner, it's fully funded and then free.
Yeah. And what's the length? So seeing a HIP, you've got a 30-minute appointment. Is it 30 minutes also?
Yes. Initially, there are some flexibility around in that primary or that initial session when you see a health coach. But the follow-ups are usually at least 30 minutes or maybe more of a check-in. And probably the difference between a health improvement practitioner and a health coach is that you can actually see a health coach multiple times to be able to coach them through whatever goal it is that they're working through. So there's a lot more follow-up for a health coach than there would be a health improvement practitioner, but there's also that passing between each other as well. So they work quite closely together to be able to support this person in whatever goal they're wanting to reach.
So it may be that we might look at the psychological barriers initially, refer them to the health coach. They might see them for 5 or 6 sessions, then they might need some more input from the HIP. So they can bounce between the two. And there is also flexibility in the HIP space as well, and extending that first appointment, particularly for Māori, for whakawhanaungatanga, or youth perhaps, spending a longer session.